Hi guys, so today we're going to talk about schizophrenia. So what is schizophrenia? It is a spectrum of chronic brain disorders that affects a person's way of feeling, thinking, and behavior patterns. It occurs in less than 1% of the population, and according to the APA, research has shown that it affects men and women about equally. There are a genetic and non-genetic theory as to why this occurs. Genetically, scientists believe that there is an imbalance in your neurotransmitters. The dopamine hypothesis states that dopamine is hyperactive in the brain, and the glutamate hypothesis says that there is a hypofunction of the NMDA in the glutamate system. There's also anatomical abnormalities that have been noted. There's frontal lobe atrophy with decreased blood volume and some excessive cerebral spinal fluid with a lower brain volume. The theory of non-genetic says that if the mother of the child who has schizophrenia has been exposed to viruses in their second trimester of pregnancy, like toxoplasmosis or influenza, or if they were possibly malnourished, that could possibly increase the risk for schizophrenia. If they have a problematic or traumatic birth, or if the child has also experimented with street drugs under the age of 21 or is under an increased amount of stress, all of those combined together can put you at risk for schizophrenia, but no one really knows for sure what exactly causes it. So the signs and symptoms, your positive symptoms, you can lose touch with reality. People can have hallucinations, delusions, agitated body movements, pressured speech, and dysfunctional ways of thinking. Negative symptoms is this more of a disruption of your normal emotions and behavior. You can have anhedonia, that not having pleasurable experiences in life, a lack of motivation. You can neglect your personal appearance. You can start having inappropriate social reactions, laughing inappropriately, a flat affect. Cognitive symptoms, that affects your memory and thinking, and it can really affect holding down a job and interfere with your daily life. This affects your memory and problem solving skills, and also you're paying attention to certain things and focusing. Mood symptoms, that's your depression, your anxiety, feeling suicidal, being agitated, and just overexcitability. So what are our treatment options? Our treatment options are a good combination between medications and therapies. The Substance Abuse and Mental Health Service Association has made a recovery model for schizophrenia, saying that treatment should be unique to each person and personalized and culturally based with social support. Medications, typically you're going to see those second generation antipsychotics are a first choice, like risperidone or olanzapine. You can have these medications taken PO, or they can also do monthly injections like the Invega Sustenna injection. Make sure you're monitoring for those EPS signs and symptoms. Therapy-wise, you can have psychotherapy that helps the patient talk about their feelings, cognitive behavioral therapy that helps them get through the root of what they're thinking and can possibly rewire their ways of thinking. Family therapy helps involve everybody in the patient's care, and good community resources are the NAMI Hope Center of Southwest Missouri. They hold support groups and have good resources to schizophrenia. They have support groups on Tuesdays at 5 o'clock that meet. Burrell Behavioral Health does employment training and assertive community treatment, and also rehabilitation and support for patients. And if you know someone who is in immediate danger, you can definitely call 911 or other emergency services. A lot of times these patients don't recognize when they need help, so the responsibility falls on the family and friends. That's about all I have, and I'm also going to post a link in the discussion board of a video that simulates what auditory hallucinations can sound like for a schizophrenic. It does have a couple of derogatory words in it, so if that offends you, please don't listen to it. And that's all I have. Thank you for watching.